Hey everybody, Jennifer Bell here, and I'm here to explain a little bit more about some different parts of Medicare. Today what I want to talk about is what a Medicare supplement is. I think a lot of people call their insurance that goes with Medicare a Medicare supplement just out of habit, but there is actually a true insurance called a Medicare supplement. They're also known as Medigap policies. So let me explain how these work. Medicare provides you with Part A and B, and this gives you your primary medical insurance coverage. When you add a Medicare supplement into the mix, what this does is it becomes a secondary payer. So Medicare is going to pay first, the Medicare supplement is going to pay second. One of the things to remember with a Medicare supplement, because it pays second, is that Medicare has to approve what it is you're going to do in order for the supplement to also pay. I like to call Medicare the engine to the train and the Medicare supplement the caboose. So basically, as long as Medicare is chugging down the track, paying your claims, paying everything that you go and have procedures done for, then the supplement's going to come right along and pay its portion too. Now, if Medicare ever derails and says, no, we don't pay for that, or we don't cover that elective procedure, then the supplement isn't going to pay either. So just remember that it has to be approved by Medicare in order for the Medicare supplement to also pay. Another thing to remember is that Medicare doesn't cover prescription drugs. So because Medicare doesn't cover prescription drugs, neither does the supplement. If you go with Medicare and a Medicare supplement, then you will also need to have a prescription drug plan. And the prescription drug plan will pick up most of the cost of your prescriptions. It really helps offset those high out-of-pockets that you'd pay if you just paid cash for medications. So it's going to lower those costs, and they're actually really beneficial. You definitely want to look at that. The other thing is Medicare supplements are also known as Medigap policies. And the reason why is because Medicare is going to pay for its portion, but it's going to leave some gaps. And so that Medicare supplement is going to come in and fill those gaps that Medicare leaves behind. So truly, a Medicare supplement is hand in glove with Medicare. A couple things you want to remember about supplements in particular is that when you first get on Medicare, so either when you turn 65 or if you get on Medicare after retiring or because of disability, you have what's called a guaranteed issue open enrollment period for your Medicare supplement. What that means is you're not going to have any health questions asked of you. You're just going to be able to apply for the supplement and get it. That's pretty huge, especially if you're going through a lot of medical problems. If you're in the middle of cancer treatment and you turn 65 and go on to Medicare, you can get Medicare and a Medicare supplement. They're not going to ask you any health questions, and they're not going to raise the rates on you because you're in active cancer treatment. If you are at work and you have employee coverage and you develop end-stage renal disease and now you have kidney dialysis 3 times a week, so you need to retire, you go on Medicare, you can pick up a Medicare supplement right away. They're not going to ask you any health questions. This is really big, especially if you have those health issues going on in your life. Later down the road, if you were to decide that you wanted a Medicare supplement and hadn't chose it right away, then what could happen is you'd have to answer all the health questions. And if you have anything going on that could potentially cause them to deny you coverage or even charge higher rates, then that's definitely a possibility. So that first time you're going onto Medicare, it's really important to definitely think about whether or not you really want that Medicare supplement, because it could potentially be the only time you're actually eligible to get it because of that guaranteed issue right away. Now, Medicare supplements can be really great. There's all different kinds, and just let me know. I can send you a chart so that you can see what they look like. But the two that provide the most coverage for 2019, one is going to cover all the out-of-pocket costs that Medicare leaves behind. All your deductibles, all your copays. That's called a Plan F. After January 1st of 2020, we are no longer able to sell that plan. Once you have it, you can definitely keep it, but it's not going to be available after January 1st of 2020. The next one with the most comprehensive coverage is the Plan G. The difference between the F and the G is the G is going to leave you the responsibility of paying the Medicare Part B deductible. So it's very important to know that. Currently, the Medicare Part B deductible is only $185, so it's not a big deal. We do know that number can increase over time. Medicare is governed by the government, and so the government is who determines what those numbers are and what the Part B deductible is. So that could increase over time, and it has in the past, usually a few dollars every year. Now, the coverage sounds really awesome because basically you pay your monthly premium for the Medicare supplement, and then it picks up all your copays and deductibles, or maybe leaves you with some small copays and maybe just the Part B deductible. But you do have to pay a monthly premium for this supplement, and that premium is going to increase over time. Now, Medicare supplements, they do not have annual contracts. They are actually month to month. So if there ever was a time when they needed to do a rate increase on your whole community, they could. Generally speaking, most insurance companies are going to lock you into either 10 or 12 months so that you don't experience the continual motion of rate increases. So you definitely want to get with an insurance agent. If you're in Colorado or Texas, give me a call to make sure that you get with a company that isn't going to give you rate increases all the time, so that you can get a locked-in rate for a 10 to 12 month period. The last thing I want to mention about Medicare supplements is they do follow Medicare wherever Medicare goes. What that means is Medicare is accepted across our whole country. And so any physician, any clinic, any hospital that takes Medicare, generally speaking, will also take your Medicare supplement. You just want to make sure you're with a really good standing insurance company so that the facility doesn't turn down that supplement because of maybe a poor reputation with paying procedures that they might have. Most of the companies that my company works with are all going to be A-rated companies, and you're not going to have that problem. Thank you so much for watching this video. I really appreciate your time. Any questions, please don't hesitate to reach out to me via email. You can check out my website, and also look at the other videos that I've posted on Medicare, answering different questions about the different parts of Medicare. And please share this with your friends. And if you're on YouTube, definitely subscribe to my channel, and then you'll get updates as I post new videos. Thank you so much. Have a great day.